It is another edition of your program of choice, Health Affair on AIT. I'm your regular anchor, Ushomowa Danes, and you're welcome. On the program, we focus on public health issues and the challenges of women and children, with a view to finding lasting solutions. Today, our focus will be on Nobel laureate Professor Wole Soyinka and his experience with the COVID-19 international travel protocol. Before we start the discussion, let's take you through our news segment.
18 infants in Vietnam were mistakenly injected with Pfizer's COVID-19 vaccine instead of other immunization shots, according to health authorities. The infants, who were said to have responded to the vaccine differently, were taken to St. Paul Hospital for proper monitoring. 48 hours after, some of the children were reported to be eating well, while some were showing signs of fever, fuzziness, and poor appetite. However, no report of the infants suffering from adverse effects have been recorded. Leading professors in the country and medical experts from the World Health Organization and the United Nations Children's Fund have been consulted in line with the incident. District authorities have also suspended the medical staff who directly injected the infants and 4 others equally involved in the incident.
43-year-old businessman Afamefuna Udensi appeared before a federal high court on Wednesday in Lagos for alleged importation of fake tramadol 100 mg. The defendant is being prosecuted by the National Agency for Food, Drugs Administration and Control (Nafdac). He was arraigned on 3 counts of importation as well as sales of fake and unregistered Fini tramadol. He, however, pleaded not guilty to the charges before Justice Daniel Osiago.
Yes, I put up, first of all, I put up a petition to the police through the SIB IROT department that affected the first arrest. One arrest led to another until we got to the main importer. So what they did, the pirates, they copied it exactly that you won't be able to differentiate the original, unless you are the sole owner. They copied both the Nafdac number and everything. And Nafdac has taken the product to the lab. It came out 0.000. Absolutely no content of chemical in it.
So the police transferred the case to us. He has pleaded not guilty to the charges.
He was arraigned, his charges were read out to him, and then he pleaded not guilty to the charges. Of course, once a person is arraigned like that, as it happened today, then you must go through another level of bail. The natural thing is for us to throw in his application for bail, which the court has been magnanimous in giving us Monday for purposes of argument. Once we come on Monday, we argue his application.
The court has adjourned the case to November 15, 2021 for hearing. The prosecutor, Mrs. Chinyere Okoli, told the court that the defendant, who resides in Onitsha, Anambra State, committed the offense on October 26th. The original Fini tramadol product that Nafdac registered belongs to Nafdac Pharmaceuticals. Nafdac said the Investigation and Enforcement Directorate also gathered intelligence on the warehouse at Onitsha, Anambra State, belonging to the clearing agent of the suspected kingpin of the syndicate, and a raid was carried out. During the operation, 171 cartons of products purportedly smuggled in from China were recovered, with the names of the suspect written on them.
To ensure that Nigerians have access to clean and safe drinking water, Nestle Nigeria introduced the first Nigeria plain sparkling water, the Nestle Pure Life Sparkling Water. The product, which is sourced and produced locally, is fortified with zinc and serves as healthy hydration alternatives for consumers. Nestle Pure Life Sparkling Water is made of purified water, has 0 calories, and is committed to promoting healthier nutrition and lifestyle for all. The water is born out of the desire to find a refreshing and exciting solution to thirst with a product that has a satisfying taste and feel.
Health experts from across the world have called for attention to diseases associated with poverty, such as tuberculosis, malaria, yellow fever, meningitis, Lassa fever, and lots more, speaking during a two-day conference with the theme COVID-19 Pandemic, Consolidating the Gains and Addressing the Shortfalls in Lagos, Nigeria. The experts noted that all attention has shifted to COVID-19 pandemic to the detriment of other diseases.
Nigeria recorded 212,446 confirmed cases and about 3,000 deaths. These figures may have increased in fold if not for advances and innovations made in COVID-19 prevention technologies through research and development. We must therefore continue to pay particular attention to these diseases of poverty, both at individual researcher and government levels, in order to alleviate the suffering of those who are afflicted with them. Otherwise, the gains of COVID-19 control may be lost to upsurge in HIV, malaria, and TB.
The conference provided a platform to focus also on mental health, COVID-19 vaccination, promotion of homegrown diagnostics, and therapeutic solutions.
We really look forward to the opportunity where Nigeria will procure these vaccines ourselves. But we are not on the table. It's very difficult. All our procurement process has to go through the COVAX facility or go through the AVAT facility, which is the African mechanism. And these are not direct negotiations with the manufacturing companies, because the developed countries have taken over these manufacturing facilities, and they are just keeping the vaccines to themselves. So we are appealing to these developed countries to allow developing countries to also be on the table, to get these vaccines and to be able to improve our global coverage.
That is the important point. It doesn't matter which vaccine you have, you should take whatever is available. And now in Europe and America, people are mixing vaccines. If one is not available, you can take another one. So that is the important message, to make sure you have 2 doses of vaccine at the minimum.
Since the outbreak of the coronavirus in 2019, that has resulted in about 4.4 million deaths globally, the world, including Nigeria, through research has made advances in diagnostics that are highly sensitive and rapid, treatment options such as antiretroviral and vaccines. The Conference on Health Advances, Innovation and Research Chair is a maiden edition that seeks to direct focus on health advances and innovations from research for national health. The conference also coincided with the presentation of research findings on viral hemorrhagic fever by postgraduate students from the University of Lagos, University of Ibadan, and University of Ilorin.
We know that even before COVID-19 became a pandemic, we have had our own epidemic of Lassa fever, particularly. It's just endemic. It's reoccurring every year. Towards the dry season, we have Lassa fever, and then also yellow fever also, and this has also claimed a lot of lives. So Nigerian Institute of Medical Research in 2017, we now decided to look at these infections that are causing epidemics and claiming lives of our people in the country. You know, what we have been doing as a nation is been reacting. You just hear there is an outbreak and they just rush there, manage some people, and we go back to rest. And another year again, you hear another outbreak, and that's how it has been. So this time around, we decided to turn the tide. And what we're doing differently now is, let's find out this viral hemorrhagic fever. We know it causes deadly disease, and they have vectors and reservoirs that are out there. Where are they? And so I got this grant from NIMR on viral hemorrhagic fever, and for the first time in Nigerian Institute of Medical Research, we now give out extramural grants to postgraduate students from the University of Lagos, University of Ibadan, University of Ilorin, for them to go and look for these reservoirs, such that we will not, before we have an outbreak, we will be able to identify and say, oh, these viruses, this is where they can be located. this is a season where they are most prevalent, and then we will be able to address it.
I worked on Crimean Congo hemorrhagic fever. It's spread through contact or bite of ticks, blood of an infected human, and as well also cattle. The unfortunate thing is that the cattle that is infected doesn't show any sign, but a human that is infected actually elicits a lot of significant clinical symptoms, including fever, hemorrhage in all orifices of the body.
So as one of the grantees, worked in Ika Northeast local government area in Delta State. So basically my findings is that even despite the fumigation that was said to have been done, the mosquitoes I collected, I checked out for the virus in them, for yellow fever virus, and about 95.46% of them are still positive. I still detected yellow fever virus in them. So that's disturbing, because it means that community is predisposed to a possible epidemic anytime soon.
The Director General, Nigerian Institute of Medical Research, Professor Babatunde Lawal Salako, and members of the Nimr Foundation Board of Trustees have called on Nigerians to support the foundation robustly, as the dividend that will accrue from it will be of tremendous benefit to all Nigerians. They made this call during the launching and fundraising for Nimr Foundation in Lagos a few days ago.
Your Excellencies, distinguished ladies and gentlemen, Nigerian researchers have what it takes and the technical know-how to engage in cutting-edge research if given the opportunity. However, inadequate funding has remained the Achilles heel, reducing our capacity to make the required contribution to national development and nation building. Having seen that the government cannot do it alone, with competing requests in the stream, we realize that there is a need to make deliberate effort and effectively bring upon the participation of the private sector to sustain cutting-edge research, training, and development in our institution. We have therefore proposed and registered a charity arm of our institute, the Nigerian Institute of Medical Research Foundation, a private not-for-profit organization to support Nimr in the actualization of our mandate.
Let me say that for Professor Salako, history will be kind to you and those with whom you serve to contrive the idea of a foundation to increase the possibilities around medical research. Many before you have also innovated around funding, but I think this is one great step in public. Well, I suspect that not a few of you might be wondering when Babatunde Fashola became a scientist, and by what authority does he convene a meeting to raise funding for medical research? You are right if you think that way, and let me put your mind at rest. I possess no medical research capacities, and I do not plan to seek any. So in 2019, the Director General, Professor Babatunde Salako, reached out to me to ask me if I would serve in a voluntary capacity as trustee of the foundation to help raise funds. In the same way, he reached out to His Royal Highness Sanusi Lamido Sanusi and to Professor Uweje, to Mrs. Munji Bakojola, who has been our MC. We all agreed to serve in a voluntary capacity. So all what you have seen here today, everything here is done on a voluntary basis. We have a constitution. We also have a code of governance to provide some integrity to the source and also to the use of any monies that we aspire to raise. Those code of governance compel us, for example, to support anti-corruption efforts, and therefore we will not be able to accommodate monies that come from openly or suspiciously fraudulent sources. We commit not to do that. We also commit to act with political neutrality because this is about humanity. So we have no political identity. We also commit to emphasize workplace safety and waste management in an eco-friendly way. So our research and the work that we commit to, we have this as codes of governance. And we commit to abstain from any work that is hazardous to children and indeed to humanity in any way. We have decided also that we will not directly manage or distribute any monies that we raise to avoid any hint of conflict of interest with our roles as trustees.
All of us have been, at one point or the other, over the last 18 months of the COVID-19 pandemic, expressed concern and disappointment that we have not lived up to our billing as a country. When people talk about vaccine appetite and talk about vaccine dominance by certain countries, the question that many have asked and that we have asked consistently in the Governors Forum, and we've brought in leading lights like Professor Oyewale Tomori to come and talk to us about this, is why we stop producing vaccines ourselves in the country. And that's something NIMR was, for just as Professor Salako has mentioned to us. But now, all efforts to get us back to that sort of production has remained in the doldrum. And I think if there's one thing that the pandemic has woken us up, all of us up to, it is to not only get to grips with whatever is needed to do this, but also to do it on a commercial scale that will make it available to other Africans, so that we can play that role that we've all been adorned with, sometimes with feet of clay giants of Africa. So supporting this cause clearly will enable the Institute of Medical Research to do that which has been very well espoused in the remarks of the DG and the chair of the foundation. We must support this cause and support it generously.
Beyond the promotion of research into diseases of public health importance in the country, the money raised from the foundation will also be used to develop human and infrastructural capacities in collaboration with medical schools, universities, and other health-related institutions in and outside the country. The Institute and the founding fathers over the years have made giant strides towards making research a tool for national development and nation building. With the contribution of good-spirited Nigerians and organizations through the Nimr Foundation, the Institute will no doubt be able to advance healthcare research for the benefit of all. The General Manager, Lagos Zone of the National Health Insurance Scheme, Olufemi Akingbade, has called on more Nigerians to embrace health insurance. Akingbade made this call at the ongoing International Trade Fair a few days ago in Lagos. He said it became necessary to take the message to where they will have access to educate more people about the scheme and its benefits and clear the air about some misconceptions.
We look at this forum as a very strategic forum where you see a lot of people, and a lot of people have the misconception that the health insurance is only for the formal sector, that is those employed by government. And one of the reasons why we are here is to let them know that it is for everybody and not only for government employees. Benefits, just like your motor insurance, is to safeguard against catastrophic spending, especially when it comes to your health. A lot of people don't have money when they have need for health care. So what the health insurance does generally is for you to prepay for eventuality. So you pay a small amount of money now, and anytime you have any need for health care, you don't need to pay out of pocket. So one of the things that the health insurance does is to eliminate the issue of out-of-pocket expenses and to make sure that people are covered when they need health care. Stage where non-communicable diseases, just like what you mentioned now, diabetes, stroke, heart attacks, and a like of others, are also covered by the National Health Insurance Scheme. And that is why you need to have joined the scheme, not when you have that ailment for you to wait. So diabetes is covered, and for now, because of the low pool of funds, we are not able to give the full cover that we are supposed to give to diabetes, because it's an ailment that doesn't have a end. That's why they call it a terminal disease. And this is a social health insurance. When it is made mandatory and everybody has a contribution in the pool, diabetes and every other non-communicable disease will be covered.
Benefit by registering, and what does it require? How much do they require? They only require 45,000 naira for a family package of 3, 60,000 naira for group.
Take home message is simple. Join NHIS, buy gift ship, and have your health insured.
Established under Act 35 of the 1999 Constitution by the federal government to improve the health of all Nigerians at an affordable cost, the National Health Insurance Scheme (NHIS) is to provide social health insurance in Nigeria, where healthcare services of contributors are paid from the common pool of funds contributed by the participants of the scheme. It is a prepayment plan where participants pay a fixed regular amount.
The Lagos state government has developed a robust vaccination strategy, leveraging on both the strengths of the public and private sectors of our healthcare system. The strategy, which is tagged "Count Me In, 4 million Lagosians vaccinated against COVID-19, is aimed at targeting the full vaccination of 4 million Lagos residents before the end of December 2021. It was launched by the Governor of Lagos State, Babajide Sanwo-Olu, alongside the Commissioner for Health, Akin Abayomi, and the Executive Director of the National Primary Healthcare Agency, Faisal Shuaib. The strategy also intends to mitigate the impact of a fourth wave of COVID-19 in Lagos, reduce its effect, and prevent the re-emergence of the catastrophes witnessed during the previous waves. According to the governor, those who wish to receive the vaccines can go to any of the designated government facilities and receive their dose free of charge. However, those who wish to receive the vaccines within the comforts of a private facility will do so at an administrative cost of 6,000 naira.
Welcome back. Nobel laureate Professor Wole Soyinka has called on the Nigerian government to review the present COVID-19 clearance requirement for air travelers to avoid unnecessary delay at the airports. Professor Soyinka made this appeal during a chat with our crew about the pains of travelers due to the compulsory online Nigeria travel portal registration platform for intending travelers.
If there is COVID and it is necessary to lock down, I don't think any of us complains We go with it because we know there's nothing anybody can do about it in the interest of the majority. You have to lock down, you have to close the borders from time to time, sometimes questionable circumstances, like economic reasons. Nigeria blocked borders against the neighboring territories not so long ago. So it's not that we're not used to it. That's what the point I'm trying to make. We've learned to go with the flow, to understand that life is not just one smooth, continuous enterprise. But when an individual is prevented from getting entry into his own country through the lapses of others, then there is a problem. A few months ago, when trying to get back into this country, I reached, through France, incidentally, I reached Charles de Gaulle Airport, had my boarding pass, and I was about to board the plane. At the very entrance to the plane, I was told I couldn't get on. I had my vaccination. I'd taken the 72-hour COVID test, and I was negative. But apparently there was one more. There was a new one called PCR. Is that correct? I don't even know these initials. Anyway, which the Nigerian government had begun to insist upon. Now, I was away from the country at the time. I didn't know this. I thought I was all geared up. I couldn't get on that plane. I had to go back to Paris. And the test, by when the offices had closed or whatever. Anyway, I spent 3 extra days in Paris before I could get back on. After taking the test and getting my result, 3 days. I did not complain. I didn't invite you to chat with you. I felt it's okay. It's my fault. I should have known. Maybe not, but I felt I should have known. But it's happened a second time, just about a week ago. This time I had my PCR, or whatever it's called, and of course I still remained vaccinated. And exactly the same thing happened to me. And of course, it did not happen to me alone. There were other Nigerians who passed the night at the airport. They couldn't leave the airport because they'd already passed immigration. But at the gate, they were also turned back. This time, it was not PCR or whatever it's called. It was that they had not gone to something called the Nigerian Travel Portal and obtained permit to travel. Well, again, it was my turn. I said, I've got everything. I've got PCR, etc. I said, no, there was one more item which the Nigerian government now required. Of course, others were again similarly affected. So I had to go back into Paris. And then I was directed where to go through this machine here and pay the necessary amount. And then permission will be generated from Nigeria so that I could travel back to my own country. All right. I rebooked. Following morning, I was back at Air France. At the hotel, we tried to get onto this portal. We could not. Following morning, 8 a.m., I started again with the hotel staff. Finally, at 10 o'clock, realizing that I might miss my flight again, I carried my bag from the airport hotel, went to Air France. I said, listen, I've got my ticket. I was given a new boarding pass yesterday. Since yesterday and this morning, I've been trying to get on this portal. I want to get on this flight. Together with Air France staff, between 10 a.m. and 2 something, we kept working. They brought their computers. Some changed my password here for me so that they could then try through their own, whatever it was, between 10 and 2 something, we did not. At one time, there were 6 members of Air France staff working on their own computers, working on this very computer, and trying, and my phone, of course, trying to get permit to return to Nigeria. We succeeded maybe around 12 or something in the receipt of a payment from my credit card being acknowledged. In other words, we got that far. But it did not generate this permit to enter Nigeria, which has a barcode, a square barcode. If I find it, I'll show it to you. Now, the process itself is really remarkable. I don't believe for a moment that it was the Ministry of Health or the Director of the National Health, whatever it is, who created that questionnaire. I think it was the minister, it must be the Ministry of Internal Affairs. I invite you all to attempt to get on that portal and tell me what this has to do with COVID after the first couple of questions. What the majority of those questions has to do with COVID, I don't understand. I went through it again, some of the questions repeated. I'm telling you that at one stage, 6 Air France staff were working on various computers to generate this permit for which payment had been made. So I asked them, do you have any other flights going to other West African countries, neighboring countries preferably, which do not require this secret service kind of questionnaire, because that's what I consider it. And they said, oh, there's a flight leaving for Lomé at 4:30. I said, put me on it. Boarding began about maybe, I think, 20 minutes to 3. I told them, make sure you get me on that flight to Lomé. There was one to Lomé. Carried my bags, ready to go to Lomé. In the meantime, one of the supervisors had come from the office. She was in Mufti, not in something, and was working the phones like mad. And suddenly she broke into a sigh, a smile of relief, came running to where I was with my bags and said, I have good news, I have good news. You've been given special permission to re-enter your country. I don't believe that I should require, or any Nigerian should require special permission to enter his or her own country. So nobody is saying don't take precautions, because the next thing they will say, well, the Shrinka said they should let everybody in and anybody at any time anyhow. No. Nobody is saying you shouldn't take the necessary precautions. Other nations do it. But I don't believe that other nationals are, not humiliated is the wrong word, no, I just obstructed the way we are. I understand that some other West African countries have similar regulations. You have to go to the portal, fill this, fill that. But if this thing is not 100% proof, why should we be punished? Because some people are technologically inefficient, and yet they're imposing these technological requirements on passengers. It's not a pleasant sight to see your fellow Nigerians lying on couches. They can't go in, they can't go out, they're trapped in limbo. I think that's wrong. And so whoever is responsible for these funds should proceed to design something easier for humanity to fulfill, and also to have backup situations. When technology breaks down, human intelligence should come to the rescue. There must be a means, for instance, for me to be able to pick up the phone myself and call a number, an emergency number, and say, here I am, I've filled the forms, this damn thing has not generated this pass that I need to enter my own country in addition to my passport. And so there's a plea to the Ministry of Health which must be involved, I'm sure, in this forum, internal affairs, which I'm convinced must have participated in this forum, which I feel, if you don't believe me, please go online and see whether that looks like a normal kind of health questionnaire to enable you to enter your own country. I don't think it should be necessary for me to go and land in Lomé and get on a motorcycle pillion again and find my way through my hunting paths from one country to the other. No, I think I should be able to fly like any other modern human being without asking for any special privileges. I could have terminated this marathon much earlier. I could have insisted, please get hold of this person, get hold of this. My name is this is my status in this country. I even have national honors, believe it or not. I could have done all of that, but I wanted them to go through the entire process, even for the second time, to find out just what the hell is going on and why one should be subjected to this kind of ordeal on earth. So it's a plea. We're human beings who will not be treated like beasts and illegal immigrants. When you go through this questionnaire, the thing you have to fill, on your computer, you just wonder what it's all about. Is it really about COVID prevention, or is it to gather information on Nigerians in a covert way, utilizing the COVID requirements? Because this strikes me. And incidentally, the Air France people, let me tell you, they found the entire questionnaire ludicrous and ponderous and unnecessarily complicated. I should use one expression. He said, repeat the same question again and again. It's unnecessary. So I'm not saying an attempt was made to banish me, but I felt like I was serving a decree of banishment, at least for 24 or 48 hours. That's exactly how I felt. You have to carry your bag as you're about to enter the plane. You go all the way back, then you go through immigration again to be let into France. Fortunately, I had a Schengen visa. Many of the Nigerians there who were transiting from elsewhere did not have a Schengen. They couldn't go into France even if they wanted. So they were banished from their own country.
I really do hope that the relevant authorities will do something about the situation. If you're just joining us, it's Etafe on AIT. Next on the program is our nutrition segment.
Mackerel, known in Nigeria as Titus, is a common name applied to a number of different species of pelagic fish, mostly from the family Scombridae. They are found in both temperate and tropical seas, mostly living along the coast or offshore in the oceanic environments. The Atlantic mackerel, also known as Boston mackerel, Norwegian mackerel, or Scottish mackerel, is native to the temperate waters of the Mediterranean Sea, the Black Sea, and the Northern Atlantic Ocean, where it is extremely common and occurs in huge shoals to about 200 meters down the waters. It has an elongated body, steel blue marks with wavy black lines dorsally and silver white centrally. Its snout is long and pointed. The eyes are large and the teeth are small, sharp and conical, and it has a velvet-like skin. Mackerel is an important fish both culturally and economically, particularly for communities along the southern coast of Norway where it swims close to shore. Its popularity in these regions has earned it the name the national fish of southern Norway. Mackerel is a highly commercial species because of its meat, which is strong in flavor, high in oil content and omega-3 fatty acids. It is used, therefore, as a result of this in many cuisines all over the world. The oily fish has been linked to many health benefits, including a lower risk of heart disease, improved mental ability, protection from cancer, rheumatoid arthritis, and lots more.
In our clinical segment, we give you vital tips to stay healthy.
Ideally, we expect it to be 120/80. The blood pressure tends to increase with age. And when it increases with age, as of definition of today, we accept that we would like your blood pressure to be lower than 120 or to be lower than 120/80 as the ideal blood pressure. But this is not what you find all over, especially with people who have developed high blood pressure. You want your blood pressure to be lower and to be close to lower than 140/90, and the closer you are to 130/80 or to 120/80, the better we are. The more you age, the more your blood pressure increases. So you can't change that, but you can do something about it, because it's not everybody that ages develop high blood pressure.
We welcome your contributions on how to improve the nation's health sector and human lives on our perception segment.
The only way forward is preventive health care. It is only in prevention that we can ensure sustainability. If we continue to do curative, which I can't afford, you possibly can't afford, then we would have more people dying prematurely. But if we go to the root cause, which is preventive health care, I get vaccinated, you get vaccinated, then we can eliminate COVID. It's not only COVID. There are many things you can eliminate by preventive care. But take your polio vaccine. Take this most necessary COVID vaccine so that we can break person-to-person transmission. Then we can revive our economy.
This is where we wrap up the show today. Thanks for spending your time with us. Please, let's do it again, same time next week. Kindly support the program by advertising your health products and services. We'll do it for you at a subsidized rate. My name is Oshomowa Danis. Please keep staying safe.